Hospitalizations in the country are up 50% since mid-June. How can the president say that the country is in good shape right now?
So I would note with hospitalizations in a lot of these hospitals, I spoke with Dr. Birx this morning, about 10 to 40% in the hospitals reaching high capacity are COVID. So a lot of hospitalizations aren't pertaining to COVID. What I would also note, and I'm glad—
Hospitalizations is not because of COVID?
Well, a lot of it is elective surgeries and other surgeries that have opened up. About 10 to 40% in the hospitals reaching capacity are COVID related.
That's White House Press Secretary Kayleigh McEnany with that response to Peter Alexander on the skyrocketing coronavirus hospitalizations. According to the COVID Tracking Project, hospitalizations topped 27,000 in mid-June, compared to nearly 44,000 this week. That's a 58% increase in less than a month. Florida reported its biggest 24-hour jump in hospitalizations yesterday, with 409 new patients admitted. As of Wednesday, Florida's state 7-day average of daily new cases was over 9,200, a nearly 30% jump since last week. And Florida health officials reported 120 new deaths yesterday. That's the highest one-day jump since early May. That brings the state's death count to above 4,000, the 9th highest total in the country. Joining us now, Chief of Trauma and Surgical Critical Care at Jackson Memorial Hospital in Florida, Dr. Nicholas Namias. Dr. Namias, thanks so much for taking time with us this morning. We appreciate it. Let me just first put to you the point made by the White House press secretary today. Is the crowding you're seeing in your ICUs, in your ERs, in your hospitals because of elective surgeries?
No. The elective surgeries have really been stopped. I mean, we're not bringing in patients who are going to need to stay in the hospital or need to stay in an ICU. So the only surgery we're really doing are patients who can go home the same day. And other than that, they're real crisis sort of emergencies, people who have an organ for transplant or trauma, something like that.
So what is the picture you can paint for us of your emergency rooms and your ICUs right now? We see the statistics, and they are statistic, but what's the real life look at what's happening inside your hospitals?
Well, the real life look is worse actually in the emergency rooms, because once you get up to an ICU, you know, we've had time to prepare and things look like an ICU, but the emergency rooms are pretty much busting at the seams right now. We've expanded emergency room capacity. We have created negative pressure in areas of the emergency room, but we have people who are staying down in the emergency room waiting to find a spot in the hospital as we try to grow the capacity in the hospital. It's like those games when you're a kid where you move the little squares around and have to get it in the right place. That's what's happening, because not every bed can be a COVID bed. And so there's a lot of work to get them in the right position.
And doctor, to what do you attribute this spike in the state of Florida? Why do you think you're seeing that crisis in your emergency rooms?
We're seeing this crisis because of the lack of a clear message to the people that they need to wear a mask, and because of the politicization of the mask, which is not politics, it's just science. You've got to cover your face to not spread germs.
Governor DeSantis says he's sending 100 nurses to your hospital system. What does the staffing look like? Do you need more people than you have? Do you need more healthcare professionals than you currently have?
Well, yes, and that's been made clear by our CEO, who requested this from Governor DeSantis, because remember, our nurses and our doctors are just part of the population of Florida. So the rate of infection in the population is the rate of infection in the staff and in the nurses. So we do have nurses and advanced practice providers who are out sick and out on quarantine. I just brought one doctor back from quarantine yesterday. So we're not in a desperation move where we need to be airlifting people in, but yes, we're constantly functioning right on the edge, and I expect this to blow up in the next week to 10 days.
In the face of these exploding numbers of cases, Doctor, the White House, President Trump, has asked the country to focus on the low death rate in this country, that the number of deaths has slowed. What are you seeing right now in terms of death rate? Are you seeing younger patients? Are you seeing healthier people come in? Are you seeing increased deaths in the last few days, as some of those statistics out of Florida have shown?
Well, yes, there are increased deaths. Now, I can't tell you, the patients are scattered over the hospital. There's many doctors, many units taking care of them. The patients I've seen with COVID are Some are extremely sick and go through the most intense things you can think of and unfortunately pass away. And others are minor. Others get some oxygen and go home. But when you have a huge and exploding number of patients, even a tiny fraction that get very sick and go on to the worst outcomes, is too many when it could have been prevented by a face mask and keeping distance.
The governor in your state, doctor, has suggested schools should be open. I know you and everybody else who has a child or rooting for kids to go back to school wants to see that happen. But at this point, based on what you're seeing in your hospitals, is it a good idea to open schools in Florida?
I think it's a good idea to ask the CDC on their first go around what the right thing to do is. And they made some recommendations, and it seems like it could all be possible, but not with recommendations that are then corrected by an executive. So whatever the CDC comes out with for schools now, I don't trust. I trust the original recommendations.
Dr. Nicholas Namias, thank you so much for your time and for giving us a look inside the hospitals in the state of Florida. We appreciate it.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.